Courtney.
Hi.
And you're Jasmine in here for an assessment, right?
Yes.
Okay, perfect. So I'm just going to start off by looking over your body here. We're going to check out your head, your face. We're going to look into your mouth, your nose, your ears, and everything, okay?
Okay.
All right, so I'm just going to start off by kind of looking at you here.
Okay.
Just gonna. All right. Skin is warm and dry. Turgor's good. Hair is equally distributed over your arms and in your hair as well.
Okay.
And move down to your legs here. All right. No edema or varicosities in either leg. Just gonna look at your hands. Nails are well manicured. Try the hands in here like this. No clubbing is noted. Cap refill is about 2 seconds, which is great. Then I'm going to start off by touching your head here.
Okay.
Any pain or pressure?
No.
Okay, perfect. And then I'm just going to feel on the frontal here. Normal cephalic also. Any pressure in the paranasal sinuses?
No.
Okay. And then I'm just going to feel the TMJ back here. If you just want to open and close your jaw for me. Perfect. There's no clicking or popping or anything. Any discomfort when you do that?
No.
Okay, perfect. And then we're going to do cranial nerve number 5. And I'm just going to have you press against my hand here. Perfect. And then this way as well.
Okay.
And then press down, push down. Perfect.
Okay.
And then also along with the trigeminal nerve, we're just going to use this little cotton swab here, and I'm just going to go across your face. Close your eyes and tell me when you feel it.
Okay. Now. 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 Now.
Great. So that is intact, which is great. And then I'm just going to talk about your face here. Your eyebrows are equal. Your eyelashes are equally distributed. I'm going to look at your lacrimal ducts here if you want to open your eyes. They look patent. The eye is moist. The sclera is white. The iris is brown and appears to be equal in both eyes. Pupils are equal. Now I'm just going to take a look at your eyes here.
Okay.
All right. And the pupils are equal and reactive to light. And then I'm just going to check the light reflex in your eyes. And I just want to see how this light reflects. And it's equal in both eyes, which is great.
Okay.
Next, we are going to look at cranial nerve number 2. We're just going to talk about this a little bit. It's the Snellen test and the Rosenbaum. The Snellen test is the regular letter chart that you look at an eye doctor's office. And that's checking for farsighted. That's usually about 20 feet away.
Okay.
The Rosenbaum is the one that you hold in front of you. That's typically numbers, or you can read, and that's checking for nearsighted. And that's going to hold about 14 inches from your face.
Okay.
All right. And next we are going to look at your eyes again. We're going to look into the back of your eyes as well.
Okay.
Your lens is clear. And I'm just going to look into the back. Red reflex is present. Doesn't appear to be any hemorrhages. The physiologic cup appears to be white and round. It's not hazy or anything, which would indicate edema in your eye.
Okay.
We're also, the AV ratio was also normal. It was about 2 to 1, which is what we want.
Okay.
And then we're going to look into your nose and your ears as well, okay?
Okay.
And actually, before we do that, I just want to test cranial nerve number 7, which is the facial nerve, and we're just going to do some tests and stuff too, okay?
Okay.
So I just want you to frown and smile and puff out your cheeks for me. Perfect. And purse your lips. Perfect. And open your mouth. Okay, that's great.
Okay.
So that's intact. And then I will actually have you follow my fingers here, okay?
Okay.
And then just follow my fingers in. All right, perfect. And this is looking at cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens.
Okay.
And then I also want to have you, we're going to do what we call a cover-uncover test. And I just want you to cover one eye at a time, and I just want to look at your other eye as you do that, okay?
Okay.
That's good. No lateral movement or shaking in the eyes. And go ahead and do the other eye and look at me. Okay, perfect. That's great. We are also going to, well, on your eyes here, there's no overlapping or anything of your eyelids either. And then we are going to look into your nose. All right. The mucosa is moist and pink. Doesn't appear to have any deviated septum or anything like that. And then I just want to look at your turbinates in your nose. So I'm just going to, if you want to press on each side and just breathe in. Good. And do the other side. Perfect. And then we're also going to check out cranial nerve number 1, which is olfactory. And I'm just going to have you smell something with that, okay?
Okay.
And close your eyes, and then tell me what this smell is.
Alcohol.
Yeah, that's it. All right. And then we're just going to look into your ears as well, okay?
Okay.
Yeah. All right, so first I'm just going to inspect the outside of your ear here. The auricle looks normal, everything is intact. And we're going to go ahead and look inside. All right. It appears tympanic membrane is intact. Looks good. And again, the auricle and everything on this side looks good as well. And the tympanic membrane looks good in here. There's the cone of light reflex, which is at about 7 o'clock. All right. And then next, we're going to look at cranial nerve number 11. Which is the spinal accessory. So I just want to have you have some resistance against my hands here. Lift up your shoulders and shrug them. Perfect. That's great. And then turn your head against my hands here. Okay, good. All right. And then we're also going to look at the hypoglossal cranial nerve, which is number 12. So this, you just need to stick your tongue out and kind of move it around, make sure that you have movement. Good. And put it in your cheek each side. Okay, perfect. That's fully intact. I also want to look into your mouth and inspect the mucosa and everything. All right. Looks great. Good dentition, the teeth are clean. I just want to look up here at the ducts and in the back as well, if you just want to move your tongue back. Okay, perfect. And then go ahead and say ah for me. Ah, all right. The uvula is midline, both without doing that and with it. So that's great. And then I also want to talk about another cranial nerve, which is number 10. And pretty much we're not going to do anything with it, but is your gag reflex okay?
Yes.
Yeah, and you swallow fine?
Yes.
And your speech is clear, which is great. And then I also need to do a couple more tests here. First off, we are going to do the Weber test. So I'm just going to hit this, and you can tell me if you can hear it. when
Okay.
it stops, okay?
Okay. Now.
Okay.
Now.
Perfect. And we'll do the other side as well.
Now. Now.
All right, that's great. And we're also going to do the Renee test. And so we're just going to put this on the center of your head and tell me if you can hear it out of one ear or both ears at the same time, okay?
Okay. It's even on both sides.
Perfect. And this is all looking at cranial nerve number 8, which is the vestibulocochlear, okay? And then we're also going to do the whisper test, and so just repeat after me what you hear if you can hear it, okay?
Okay.
Let's see.
Today is June 6th.
All right. Which it doesn't matter if it's accurate, it's just if you can hear it. And then
We're in a hospital.
perfect. All right. And then I also need to look at all of your lymph nodes and everything, so we'll check that out as well, okay?
Okay.
I'm just going to press on you here. We're going to look at the auricular. I'm just going to feel these here. All right. And back behind. And the post-auricular is back here. And we're going to go down here into submaxillary. All right. No pressure down here.
No.
And I'm just going to feel all the way down here. And then up above your collarbones. And everything feels great. And you said no pressure or pain or anything. Haven't been
No.
sick recently?
No.
Okay, great. And then I just need to listen to your pulses. With the bell of my stethoscope here. And this is just the carotid pulse. Perfect. Right. There's no worries or anything abnormal noted with that. And I just want to touch them here. That's perfect. Okay. All right. And then next, I need to look at your neck and your thyroid gland, okay?
Okay.
I'm just going to feel along here. The trachea's midline. Everything feels to be intact here. Can you swallow for me? Perfect. All right. And then I'm just going to stand behind you here, and we're going to try to palpate your thyroid gland.
Okay.
All right. So I'm just going to hand here. All right. And then turn your head to the side for me. All right. And go ahead and swallow. Perfect. And to the other side. Perfect. All right. The thyroid is only palpable when you're swallowing, which is good. That means it's not enlarged or anything like that.
Okay.
Next. That's it. All right.
Okay.
Thank you.
Thank you.